Hi, it's Dr. Robert Davis with Active Health Knee and Shoulder, and I am here with Walter. And Walter was kind enough to stop by, and he was picking up a card for a friend of his, and we haven't seen him for at least a year.
Yeah.
So it's been at least a year. Walter came in, he had some problems with his knees, and I was going to let him just basically talk about the problems he was having before he came in, and then he's doing fantastic, so I wanted him to tell you a little bit about what he's been up to. So if you can just say, basically tell everybody, like, what type of problems were you having, and when you came in here, what experience did you have in the office, and what have you been up to since?
Well, I had lots of pain.
Pain in the knees.
In the knees.
Yeah, right.
And you know, you get depressed and
Yeah.
pain is, who likes pain?
Right.
So I heard about you
Right.
and you did you did only one manipulation,
Right.
and then the rest with the machines.
You did therapies afterwards. So we did one procedure on you,
Yeah.
and that fixed you, and then we did the follow-up therapies afterwards.
Yes, and people, I read up how you can do it, but you did it,
Right, right.
and so I'm happy about this because I don't believe in operating. It's
Right. You were facing a knee replacement.
yeah.
Yep.
Well, I had this one done,
Right, right,
and luckily it didn't, no problem.
right. Good.
But it's not always turns out like this.
No, it doesn't.
It does happen like 15 years ago,
Right.
you know.
So when we're working on this knee, we're also working on the connection to both knees. So it absolutely helps with how both your legs are functioning.
Yes, yes.
So you're back playing tennis,
Oh yeah, I played
Yeah.
tennis and
and you were doing a squat before. You want to show us the squat? Be careful.
yeah, okay.
Yeah, that's fantastic.
I do.
Yeah, I mean that's yeah. I love it. So thank you very much. I'm glad you're doing better. It's great to see you,
Yes.
and I look forward to seeing you progress over the years to come. All right, great. Thanks.
Thank you.